Make your next move with American Express Business Platinum. Earn 5 times membership rewards points on flights and prepaid hotels booked on AmexTravel.com. And with a welcome offer of 150,000 points after you spend $20,000 on purchases on the card within your first 3 months of membership, your business can soar to new heights. Terms apply. Learn more at americanexpress.com/business-platinum. Amex Business Platinum. Built for business by American Express.
Heart disease, Alzheimer's, rheumatoid arthritis. So many conditions are inflamed by inflammation. But what if the solution isn't a pill, but instead a nerve network inside you? Stay tuned as the world's leading expert reveals the power of the vagus nerve. Hi everyone, I'm Barbara, and this is Age Better. I think you all know by now that I get obsessed with things, and once I get obsessed with something, I can't rest until I've done an episode about it. So what's my new obsession? The vagus nerve. And it has not really a new obsession. I've had it for about 2 years, ever since I had Patrick McEwen on the show talking about how to breathe properly for better health. And he talked about how breathing can affect the vagus nerve. And so I immediately started a deep dive into this crazy, complicated, but brilliant part of our bodies. And at the time, about 2 years ago, I didn't know anything about the vagus nerve and just assumed it was a nerve, right? But oh boy, was I wrong. And once I decided I needed an episode focused on this network of information that travels around our bodies from the brain to the organs and back again, I thought, so who is the expert I should have on the show? Well, guess what, everyone? All roads led to one man and one man only. And yep, that man is my guest today. Yes, it's taken 2 years to make that happen, but it has happened. So it's my great honor and sheer delight that today we're kicking off a special 2-part series with a conversation that could change how you think about treating chronic disease. My guest is Dr. Kevin J. Tracey, a neurosurgeon, the president and CEO of the Feinstein Institutes for Medical Research, co-founder of SetPoint Medical, and the founder, also the father, of the field of bioelectronic medicine. He's also consistently ranked among the most quoted, most cited medical experts in the entire world. In part 1, which you will be hearing in a minute, we'll unpack the details of the groundbreaking FDA-approved teeny tiny implant, like the size of a vitamin D pill, that stimulates the vagus nerve to tame the most debilitating symptoms of rheumatoid arthritis, a development being hailed as a true paradigm shift. This was just announced last month. This is brand new and landed on the front page of the New York Times. Dr. Tracey leads the decades-long research behind this breakthrough, and he envisions a future when devices like this might replace medications entirely. And in May, Dr. Tracey came out with the seminal book on the vagus nerve called The Great Nerve, which we will be discussing in great detail. And I'm thrilled to announce something very special. I'm giving away copies of Dr. Tracey's incredible book. To enter after you've listened, just share the link to this episode on Instagram or Facebook and tag me. Winners will be announced next week when part 2 launches. Okay, everyone, let's get this conversation started with the world's leading authority on the vagus nerve and get ready to age better. Dr. Tracey, welcome to Age Better.
Thank you for having me on, Barbara. It's a pleasure to be here.
I am so excited. We had a nice chat on the phone last week, and at that time, I did reveal to you that I have a little bit of an obsession with the vagus nerve, and I decided about 2 years ago when I started this obsession that I had to have an episode focusing on the vagus nerve, and then I started asking people who are really in the know, including many esteemed medical experts, who should that person be? Who should that expert be on the show with me to talk about the vagus nerve? Well, Dr. Tracey, as I told you, and as you already know, all roads lead to one person and one person only. And that person is you. It was you. No one ever said any other name. And so here you are. How happy am I right now?
Well, I'm really happy to be here. It's one of my favorite topics, as you know, but we really need to put it out there right now. There are many, many people who know a lot about the vagus nerve and who've worked on it for many, many years. My colleagues here at the Feinstein Institute in New York, but others, friends and colleagues around the world in dozens, if not hundreds of laboratories. So it's a big, complicated topic, and I'm happy to talk about it all day long, but a lot of other people know a lot about it as well.
True that, of course, but you're considered the father, the founder of bioelectronic medicine, which is a kind of a new subset of medicine. And so, again, all roads did lead to you, and here you are, and I'm a very lucky person right now. So, but I want to congratulate you. I mean, you had some really, really big news. You and your team at SetPoint, a company that you helped to found a while ago, actually, and you had an announcement that made the front page of the New York Times. That is hard to do, as we know. Usually anything medical is put back in the science section, but this was on the front page because it really was big news. How does it feel? We'll get to what that is, but how does it feel that after decades of hard work and research with a team that you made this breakthrough? And it's an incredible and life-changing breakthrough. How do you feel?
I feel very fortunate to have met some patients now who have been treated with an idea that was born in my laboratory here in New York, but developed by a company that my colleague Shaw Warren and I co-founded in 2007, SetPoint Medical, a California company. When you really understand the whole story of how many dozens and dozens at first and then hundreds of people touched the science of this idea going back to the late 1990s, actually.
Mm-hmm.
And then the investors who took tremendous early risk early on, investing in the idea, not only in my laboratory, but then later in the company, to the early employees in the company who took tremendous risk of their own careers and joined the company at an early stage before any of this was proved to be true. And then people in the company collaborating with investigators around the world to launch the clinical trials, and all the early patients who
and
took
the patients. Oh my gosh.
They took their own risks signing up for a clinical trial, not knowing if they would gain any benefit and perhaps hoping they would, but also perhaps hoping it would help other people. Then to the FDA and the regulators who had to take a hard look at this. It's totally new, the idea of using a device to treat rheumatoid arthritis instead of using drugs. This required a whole new way of thinking about things. Barbara, when you look at all those people and you look at all those years, you have to feel happy, of course. I do feel happy, but you have to also feel very fortunate. And the icing on the cake is when you meet a patient who says that she's better and doesn't have to take medications anymore because her rheumatoid arthritis symptoms have gotten significantly better from this idea.
An incredible breakthrough. And we will get into more detail about it in a few minutes. But first, before we do, I really feel it's important that for those in my audience who really don't understand exactly what the vagus nerve is, please just explain, what is it? Where is it in our body? And why are we focusing on it so much now? Why is it so important that we know about it?
The vagus nerve is a paired structure. So we say vagus nerve, but you actually have two of them, like two thumbs and two kidneys. And it arises in the bottom of your brain. It's technically, anatomically, it's one of the 12 cranial nerves, one of the 12 pairs of cranial nerves. It's the number 10. And so it starts down at about the base of your brain, at about the level of your ears, and it travels across your neck on both sides and across your chest on both sides, down into your abdomen. And all along the way, it's sending off branches. It almost looks like the roots of a tree. If you were to take all the dirt away and just see the tree roots, it spreads itself out to touch all the organs that you never think about all day long. And the reason that there's so much interest in it now And there are billions and billions of web impressions and social media impressions.
And a lot of social media influencers who are telling us how to kind of stimulate our vagus, but we'll get to that later.
Absolutely. Yeah. Absolutely. The reason that people are trying to understand how to stimulate their vagus nerve or inhibit it in some cases is because the signals that it carries are coordinating how your organs in your body that you never think about all day long. It's coordinating how they work and how they work together in harmony. So you're sitting on the doctor's table, remember that time, and the doctor thumps your knee with a reflex hammer and your leg pops up and you said, "Who did that?" Well, that's a reflex. Those signals traveling in the nerves from your knee to your spinal cord and back to your thigh, those signals all happen very, very quickly and without your conscious control. Well, that same kind of thing is happening in your vagus nerve, but it's a little more complicated than that because I said you have two vagus nerves. Actually, inside each of the vagus nerves in your neck, you have 100,000 fibers. So really the way to think about it is you have 200,000 vagus nerves. And that's a rich source of data traveling mostly from the body to the brain. 80% of the signals travel from the body to the brain, but then from the brain back down to the body. And it's these signals traveling up and down from your kidneys and your pancreas and your liver and all the organs that you don't think about all day long. Those signals are informing the brain about the status of your organs and then reacting to the input with outputs that stabilize the function of your organs. And so that's the interest in the vagus nerve. It occupies a central role in maintaining sort of harmony and balance, which is what we call health.
Yes. It's just incredible. I mean, just what you described. I have a zillion questions to ask you. I could keep you here all day long, but I knew, of course, I had to kind of like call the most important ones, at least the most important ones for me, and I believe for my audience. But a lot of the information I was looking for about the vagus nerve is included in your incredible book that just came out in May, just a few months ago, The Great Nerve. Highly recommended, everybody, if you really want to understand. But not only do you give us the understanding of what's going on inside our bodies, like you just gave us the summary, but great detail about that, but also the history, how we even got to where we are right now. And also your incredible backstory. And you have a few backstories, really. Not only when you decided to enter the medical field when you were 5 years old, but also when you decided to kind of start going in this direction with a baby girl. I mean, incredible stories. And there was a great TED Talk that you did that everyone I will include in the show notes. You must watch it. It was moving, but will tell you a lot about the vagus nerve and also what motivates people to take the paths that they take. So highly recommended. But again, The Great Nerve, great book. We will talk about this a little bit more in a few minutes. But first, just wanted to get back to it. So like right now as we're sitting here, what's happening? It's like 200,000 fibers going up and down, sending signals. I'm moving my hands. My brain is saying, my stomach might be growling. I don't know what's going on inside our bodies right now.
It's really important question because it hits to a point that I think is commonly overlooked by the casual reader on social media or on the internet. So people like to say, well, I want to stimulate my vagus nerve. And when someone says that to me, I say, oh, really? You have 200,000 of them. Which one do you want to stimulate? And the reason that's an important insight is because we learned, for instance, from laboratory studies, I'm thinking in particular of work done by my colleague and friend at Harvard, Steve Lieberlis, whose laboratory asked a very simple question. If a mouse, which is of course a lot smaller than a human, has 5,000 vagus nerve fibers rather than 200,000, how many are required to breathe, for the mouse to breathe? Now, think about it for a minute. We can all walk and chew gum. Some people can play the piano and talk to their children or their dog. Other people can do multitasks and lots of different things. And the reason that we can do walking and chewing gum at the same time is that the nervous system is highly specialized. So individual nerve fibers have individual anatomic origins and insertions, beginnings and endings, and they have specific functions. And so you can operate different circuits, different nerves at the same time because they do different functions and they come and go from different places. Well, the same is true of the vagus nerve fibers. And so when Steve asked the question about breathing in mice, he discovered it was on the order of like 110 or 120 fibers were necessary and sufficient for the mouse to breathe. I mean, that's remarkable. That's a very small number of fibers. And so if you move that same kind of logic into a discovery that my colleagues and I made about how the vagus nerve signals can turn off or inhibit inflammation, we estimate of the 200,000 fibers that about 1,000 of them are specialized in turning off inflammation. Maybe another few hundred or 1,000 are specialized to slow your heartbeat. Others may be specialized, some relatively small number, to control your insulin release from your pancreas. So when you start to put these pieces of the puzzle together, you come up with a really interesting mosaic where of all the information traveling in the vagus nerve, different fibers have the ability to significantly affect the outcome of different organ functions. And that's all happening essentially at the same time as we're sitting here talking.
It's just incredible. And you also mentioned a word that is my other obsession, and that's inflammation. And you were on the Tim Ferriss show just last week, actually. I listened to it. Really fascinating. Well done. And that went on for a long time, and he asked some incredible questions. Everyone, I'll put the link in if you want to listen to the Tim Ferriss interview as well. It was really good. But I recall that both of you were kind of snickering at the word inflammaging. And I have to say, I am guilty, very guilty of having used that word a lot when I write about it or talk about it. And maybe I'll stop using it now because I don't think you really like that word so much. But you came up with something called the inflammatory reflex. So kind of explaining how the brain through the vagus nerve can actually turn off inflammation. And inflammation, as we know, and as you discuss with Tim Ferriss, is like a root cause of so many chronic diseases and ailments that we have. Arthritis, Alzheimer's, I could go on and on and on. So talk to us about that, please.
I think there's a really important point you're making about semantics. And so let's start with what a definition of inflammation is and see how it applies to inflammaging and other uses of the word inflammation as might occur in Alzheimer's disease or diabetes. Because it turns out it's not so obvious to me anymore. We really probably do need more precision in the words we use to talk about this. Let me explain what I mean. Inflammation was defined thousands of years ago by Galen and others before and after him to mean the heat, the redness, the swelling, and the pain that occurs at the site of an injury or an infection. Now, that's what inflammation has been for 2,000 years. In the more modern era, the last 20, 30 years, we've come to understand that redness, heat, pain, and swelling, those conditions come about because of molecules made by white blood cells, molecules called cytokines, and other molecules like eicosanoids. And these molecules contribute to your body's ability to make that redness, the heat, the pain, and the swelling. Okay, so now we've taken inflammation from something you can see in the infected pimple on your arm to molecules and cells that you can't see. So what does it have to do with inflammaging or the inflammation you see in the context of, say, Alzheimer's disease? Well, if you look in the brain of an Alzheimer's patient, you don't see redness, you don't feel heat, there's no pain associated with it, and there's no swelling, really. If you look at the pancreas of a patient with type 2 diabetes, which is caused by insulin resistance and is typically seen in the obese population, if you have a sophisticated laboratory and are able to do this, you might be able to measure those molecules I talked about, the cytokines and the eicosanoids, but you don't see a lot of white blood cells. You don't see the other signs of inflammation, the heat, the pain, the redness, and the swelling. So we really are running out of appropriate words to describe what we really already know. When you apply this to aging, what we see in aged tissues and aged people, you see the accumulation of some of these inflammatory molecules. And the word inflammaging has been used by a lot of brilliant people and published in a lot of important peer-reviewed manuscripts. There's nothing wrong with the word. The question is, how do we incorporate that into what we know about how to treat inflammation today with biologic agents, with the drugs you see advertised in every nightly newscast and in every Sunday football game? That's where the disconnect comes, is connecting the molecular mechanisms to what we're calling inflammation. I think I've challenged my colleagues in this book, in The Great Nerve and elsewhere. We maybe have to start to think hard about the words we use to describe what we understand. It might be time for kind of a little bit of a shakeup in how we describe inflammation.
Yeah, no, I agree with you. But what's the connection between the vagus nerve, getting back to that, and the brain, and how does it really impact inflammation? What's the connection?
The connection, which came as an enormous surprise
Yeah.
some 25 years ago in my lab, give or take, the connection is that the brain sends signals down the vagus nerve to your spleen and other organs and can turn off those molecules, the cytokines and the eicosanoids and the white blood cells that actually cause the inflammation. And that discovery, which came after an unexpected finding, we were actually studying the brains of animals with a stroke. And we put an anti-inflammatory molecule into the brains of these mice and rats in the hopes that reducing the inflammation in the brain would reduce the amount of damage from the stroke. And that did happen. That's what we expected. But what we didn't expect is that when we put this anti-inflammatory experimental drug in the brains of the animals in very small amounts way too low to actually go into the body and act as inflammation suppressing drugs, in these very same animals, when the drug was in the brain, the inflammation in the body of the animals was turned off.
Incredible. Incredible.
It took months to realize and prove that if we cut the vagus nerve in those animals, the effect was lost. And so we had proved back in like 1998 that signals traveling in the vagus nerve were like the brakes on your car. And if you turn on those signals, like turning on your brakes when you pump on the brakes, that you could slow the amount of inflammation in the body. And so I wrote on the back of a napkin in 1998, we should be able to develop computerized devices implanted on the vagus nerve in the neck of people with severe conditions like rheumatoid arthritis to turn down the amount of inflammation they're experiencing and potentially to give them relief from their condition. And you talked about the front page of the New York Times in the opening, and that's exactly what happened.
Yeah, let's get right to that now. I want to go into detail about that. I want people to know about it. And there will be a link to the New York Times article as well, of course. But so it's a set point device. That's the company you founded. And so what does it actually do? And how does it stimulate the vagus nerve to reduce that inflammation so it could impact the severity of the symptoms of people with rheumatoid arthritis? And as we know, and as you describe in your book in great detail, and also in the article in the New York Times, that, as we know, rheumatoid arthritis can be debilitating and there's no cure, and it just gets worse. I mean, you can't, these people who are your patients, who have been in the trials and so on, they actually are living their lives again. It's just unbelievable. So tell us about that.
To begin with, what rheumatoid arthritis is, as you said, it's not the sort of my knee is sore because I injured it playing volleyball in high school and now it's going to rain tomorrow, that kind of thing. This is a serious autoimmune condition. It occurs in people whose immune system have, for unknown reasons, no one knows why, begun to
I hate to interrupt you, but I just want to point out, in case you weren't going to, that this does affect, I believe, 3 times as many women as it does men. Am I correct?
Absolutely right. It tends to affect women more than men, and it tends to affect people in the prime of their lives, in their 20s, 30s, and 40s, and it can be quite disabling. And what happens is the immune system sets up an attack against the joints. Many people have seen the pictures or have relatives where their hands are badly deformed from rheumatoid arthritis, and this used to be more common decades ago, but it can lead to severe pain, disabling pain. The pain in the joints can be so severe that some patients can't pick up a pencil or ride a bicycle anymore. Some patients can't even walk up a flight of stairs or button their own shirt or blouse. So yes, it's a serious condition. It doesn't only affect the joints, but it can also affect the other organs like the brain and the kidneys and even the heart. So it's a serious medical condition. The primary treatment for years has been to use drugs that are called biologics that are often injected, almost always injected every 2 weeks or once a month. And they work at about 40% of the patients or so. But unfortunately, for the patients that don't gain benefit, there's few other options. The biologics and even some of the oral drugs called the JAKs or the JAK inhibitors, those have very serious side effects. In fact,
Yeah.
many of them carry black box warnings, which is the most serious side effect the FDA can give. And so the point is if there's an option for some of these patients who are not getting better from their current therapy, then the patients are very interested. Now, to give you some insight into how interested the patients actually are, when Set Point Medical was launching its clinical trial of this idea to implant a vagus nerve stimulator in the left neck about the size of a multivitamin or a fish oil pill that would activate what's called the inflammatory reflex. We can talk about that for 1 minute a day. They needed 242 patients in the final trial. We can talk about how the patients were randomized. But what was so amazing and telling for your listeners is that upwards of 25 to 30,000 patients logged into the website and filled out the application. It wasn't just a one-click thing and done. These people sat there and tried to get enrolled into the clinical trial. So you tell me about the pent-up demand in this population looking for new options.
Yeah,
And
no,
that was
that's
the first clue.
incredible. And how did you choose? It must have been a very complicated process, of course, out of that group.
Yeah, so full disclosure, I am not an employee of the company. I did start the company, co-founded it, as you said, but I'm a consultant to the company, but I'm not an insider and I didn't do the trial. That trial was led by the CEO, Murthy, and by the chief medical officer, Dr. Chernoff. So together, that would be a question for them. But I think the point really is clear that if you look across the universe of patients, there's 1.5 million eligible patients in the United States today, that there's a tremendous interest in pursuing a therapy, even if it requires a 1-inch incision as an outpatient procedure in your left neck. There's a tremendous interest in people wanting to try this because they're not happy with their current medical therapy.
Of course. And the New York Times rightly called it a true paradigm shift. I mean, this really is a shift in treating RA specifically. And why is it so different? Well, I guess you already explained that, why it's so different than what has been done, the treatments that have been available for decades. There are side effects. There's a black box in some cases attached, and they don't always work. And also, my understanding is that you have to be on these drugs forever. I mean, it's not like a one and done. And so there's a cost involved, very, very expensive. So you have that going. And then now you have this new paradigm. You have this new treatment. And so how are people feeling about that? Are you constantly getting more and more people who want to get enrolled with no more trials? I mean, the trials are over. But to get this treatment, like what's happening? What's the status?
There's a tremendous interest now in patients who want to seek this therapy from their rheumatologists because they have either not had successful treatment with their biologic, or they can't afford the biologics anymore, $50,000 to $100,000 a year.
Yep.
Or they don't like the side effects, or they don't like injecting themselves because that's another way of having an invasive therapy, right? And so, yeah, there's a tremendous interest in this. To begin to handle some of this interest and to offer the services here at Northwell Health in New York, we opened a few months ago in preparation for this a Center for Bioelectronic Medicine that is available to treat patients. Now, the FDA approval today is for rheumatoid arthritis in people who are either refractory to, not responding to, or can't tolerate biologics. And that's very clearly laid out by the FDA's label. But for patients who are interested, we have a patient navigator, and you can email all one word, Center for Bioelectronic Medicine, Center for Bioelectronic Medicine at northwell.edu. And patient inquiries are answered through that from a navigator. I think that at the end of the day, we have to acknowledge that clinical trials will continue.
Okay.
Worldwide, I estimate maybe 300 people have been treated in various clinical trials using bioelectronic vagus nerve strategies to treat either rheumatoid arthritis or Crohn's disease. So these are still early days.
Yeah.
The results you pointed out, there have been some dramatic clinical effects. I've met several patients, including Kelly Owens, who I write about in the book, and whose cane is sitting here behind me in the corner of my office because she doesn't need it anymore. It's a beautiful story.
cane, that's a great story. Again, in the book, in The Great Nerve, everyone, a wonderful story. And she's really in several places, including Tim Ferriss and I agreed. We really both like that chapter toward the end, the coda, and where we hear a little bit more about Kelly, and just an incredible story. What she did to put herself in those trials in Europe at that time. It's a wonderful story. Can you just tell us a little bit about Kelly? Do you
Sure.
mind? Yeah, thank you.
Kelly, as a young girl, a teenager, developed a swollen knee after a minor sports injury. And one thing led to the other, and she was given a diagnosis of Crohn's disease, which is an inflammatory bowel disease, which is an autoimmune condition. And in Kelly's case, she not only had gastrointestinal issues and symptoms and signs, but she also had inflammation that settled in her joints. So she looked almost like she had rheumatoid arthritis, although her actual diagnosis was Crohn's disease.
Mm-hmm.
So she had tried to be treated she was treated in New York and in the Mayo Clinic and in Hawaii and other places in between, New Jersey, but was finally being told by her physicians that they didn't have any other ideas for her other than spending the rest of her life taking steroids, which of course is something nobody wants to do. The side effects are terrible from that too.
Right.
Anyway, she heard me on Huffington Post Live, and she emailed me or called the office, I'm not sure which, and I recommended to her, or my office did, that she seek the clinical trials from Set Point Medical. Well, she found a trial being opened in Europe, one of the first trials, and she talked her way into it, sold all her earthly belongings, moved to Amsterdam. In order to do this,
With her husband, I
with
believe.
her husband, Sean.
Yes.
Yep, with Sean. As they joke, they sold everything that wasn't chained to the floor. They did a GoFundMe kind of fundraising thing with families and friends and neighbors.
Mm-hmm.
And she moved there. She and Sean moved there for 6 months. And at about this time, after she had her vagus nerve surgery, implanted a device in her left neck. Her device I call Gen 1. It's like a cardiac pacemaker that sits under the collarbone, and then a wire, a lead that is tunneled under the skin up to the left neck where it meets the vagus nerve by the carotid artery. She had had a surgery. It was very uneventful, very successful. And they were going for a follow-up appointment to see the doctors in the trial. And there was elevated train there on the way to get her to the hospital. And Kelly saw they were running late, and she ran up the stairs to hop on the train. And she turned around like, where the hell's Sean? And he was standing at the bottom of the stairs with tears in his eyes because he couldn't remember the last time he'd seen Kelly be able to run up a flight of stairs.
I love that story so much. I read it and reread it. And actually, I would love to have Kelly on my show too.
Oh, you should.
I would. And in fact, I'm going to make that happen. I would love to hear from
She's
her. And I
great.
know my audience would love to hear from her too.
Kelly's great. So
yeah.
I got to know her
that's
very
a great
well.
story. And wow. So you got to know her well.
I got to know her very well because we hired her. She worked at the Feinstein Institute for several years with me and my colleagues. And her role was to be a leader of patient advocacy. She collected all the emails and phone calls we were getting and built a database of patients who were really interested in helping by joining clinical trials. But that really takes us back to where we are now. We talk about Kelly as such a success story, and she is. And I met several other patients with similar stories now. So she's not a one-off, but we still don't know, Barbara, and this is really important. No one's advertising this as a cure-all. No one is promising this is going to help everybody. There's still a lot that we have to do and a lot that we will learn, because I fully expect that based on the current data are that 80% of the patients 1 year after the vagus nerve implant, these are patients that were selected because they have rheumatoid arthritis, but are not getting better with biologics or JAK inhibitors, that in that cohort of patients, about 80% of them derive some significant benefit. That means 20% either derive no benefit that was noticeable, and some cohort of the 80% had a much more significant advantageous response than the rest. So how that all sorts out is something we have to be eyes wide open and very careful, but it's very, very clear that this can be done safely. It does not cause immunosuppression.
Mm-hmm.
It does not cost $100,000 a year for life,
Right.
recurring annually, and it can be safely done. So I think it's going to come down to early adopters and late adopters on the physician side. I think you will have some physicians very aggressive about recommending this for their patients, and some other physicians who will be cautious, conservative, and go much slower. And that's okay. That's okay.
Yeah.
But you're also going to have something happen in the patients, and you're going to have patients who are now better informed and smarter than any other time in the history of the human race, because they have access to the data and they can make decisions. They can participate in some of the decision making. And I think you're going to have patients demanding this.
Absolutely. And just so my audience knows, right now is Northwell at your center the only place where you can get this treatment?
That's a question for SetPoint Medical.
At SetPoint, yeah.
Yep. SetPoint Medical has an outstanding website. I would encourage your patients to look there.
I'll put it into the show notes so they can take a look. Yep. Mm-hmm.
We did implant the first 2 patients under FDA approval about a week ago at Northwell, the first anywhere in the United States. And those patients are now out there about ready to, I would imagine, it was about a week or 2 ago. So they'll be in the process of having the device activated, and hopefully they'll have a clinical response. There are a lot of logistical issues to launching a brand new medical product. There are logistical issues with establishing what's called prior authorization mechanisms, dealing with the insurance mechanism. All those things are happening. There's an army of people working on that at Northwell and at SetPoint. My understanding is that SetPoint will have a sort of a slow launch in the coming weeks and months at several sites across the United States, where there will be the necessary expertise and experience. You don't want to launch something completely new just out into the universe and see what happens. You want to, for the sake of everybody involved, you want to have the best people who are trained to do this, doing it on the right patients in a few select centers. And I believe that's the phase we're in now. However, in the coming months and years, I think you're going to see a lot more clinical trials. I think you're going to see studies in multiple sclerosis. I think you're going to see more studies in inflammatory bowel disease. And who knows, the list of potential autoimmune conditions that should be studied. We don't know until we have the randomized clinical trial data, but should be studied. It's a long list.
So that's where we'll pause part 1 of my 2-part series with Dr. Kevin J. Tracey, the pioneer of bioelectronic medicine and the world's leading authority on the vagus nerve. Today you heard how his decades of work on the vagus nerve have led to a truly historic FDA approval, a device that may transform the way rheumatoid arthritis and other inflammatory diseases are treated, and so much more. In part 2 of this 2-part series, which airs next week, we'll go even deeper. How women are disproportionately affected by autoimmune diseases, how vagus nerve stimulation could expand to conditions like lupus and Alzheimer's, and what the science really says about breathwork, cold therapy, and other natural approaches that you can do at home that you just might see promoted on social media. You know, like what's working and what really doesn't. Okay? All good to know. And don't forget, a few lucky listeners will win a copy of Dr. Tracey's new book, The Great Nerve. To enter, simply share the link to this episode on Instagram and Facebook and tag me. Thanks for listening, everyone. Talk to you soon. Thanks for tuning in, everyone. If you enjoyed this episode of Age Better Podcast, please do a few things. First, share it with all your friends and family. Then, subscribe to Age Better wherever you listen to podcasts, including YouTube, so you never miss a single episode. Finally, if you have ideas for topics you want me to cover in a future episode of Age Better, send an email to agebetterpodcast@gmail.com or reach out to me on social media. Until next time, remember this: we can't control getting older, but we can control how we do it. Talk to you soon. Age Better Podcast is a proud member of the Sound Advice Network. Sound Advice, women's voices amplified.